So I think we're going to discuss the data from the CARTITUDE-1 trial tomorrow. That's one of the topics that we are covering. And actually, CARTITUDE-1 was a study in which a new CAR T-cell product, cilta-cel, was applied or administered in patients that had received at least 6 lines of prior therapy. And we knew at that time from different analyses that the likelihood of responding of these patients to any treatment was around 30%, and a median progression-free survival only about 4.6 months. Now with cilta-cel, the overall response rate improved from less than 30 to 97.7%. And we had about 82% complete remissions and the median progression-free survival with 34.9 months. So there was a major step forward. And there has been a long-term follow-up, which is, I think, also presented at this meeting, that a third of the patients, just remember, 6 lines of prior therapy, 84% triple-class refractory, were still alive and disease-free 5 years after CAR T-cell infusion. And in a single institution, they also checked their patients and they were MRD negative. So 5 years after CAR T-cell infusion, still MRD negative. I think this is a first hint that even in patients that are heavily pretreated, there can be long-term disease-free survival following CAR T-cell therapy. So I think CAR T-cell therapy is really a big hope for immunotherapy. And we are now moving CAR T-cell therapy to earlier lines of therapy. Now in the CARTITUDE-4 trial, patients have received CAR T-cell therapy after 1 to 3 prior lines of therapy versus CARTITUDE-1, where it was applied after 6 lines of prior therapy. And the earlier application induced a higher response rate and especially a longer progression-free survival and overall survival. And now CAR T-cell therapy is moving to first-line therapy. So in the CARTITUDE-6 trial, actually there is a head-to-head comparison between transplantation, autologous stem cell transplantation, and CAR T-cell therapy. So with this, I think we are going to see immunotherapy coming into earlier lines of therapy. And in addition, we also see that now the bispecifics are coming in addition to CAR T-cell therapy. So there's the aMMbition trial in which bispecifics are given either before or after CAR T-cell therapy. And we hope that this will further increase the response rate, the rate of complete remissions, and especially the progression-free survival, and hopefully also cure some patients with multiple myeloma.